everyone, my name's Jessie and this is my audience.
Hi, I'm Serenity. I'm a sophomore in high school and I'm 15 years old.
Alright, Serenity, so I'm a dental hygiene student. Do you know what a dental hygienist does?
Not really.
Not really? So what we do is we provide preventative care and preventative measures to help prevent oral diseases and cavities. We also scale teeth to remove plaque and calculus. So in other words, we clean teeth. And we also educate people on how to properly care for their oral hygiene and their oral health. First, we're going to be talking about what plaque is. So plaque is a sticky film of bacteria that constantly forms on your teeth. This bacteria can be found in all over your oral cavities, such as your teeth, tongue, your gum tissue, as well as the insides of your cheeks. If you don't properly remove the plaque, it can lead to gingivitis, which is a gum disease. It can lead to cavities, and it can also lead to other periodontal diseases. Some of the factors that contribute to plaque buildup are lack of mechanical removal, and what I mean by that is not brushing enough, flossing, or you could use a water pick as well for mechanical removal. And your diet plays a huge role in the buildup of plaque. So now I'm going to have you watch a video which includes an overview of plaque.
Okay.
What is plaque? Plaque is an extremely sticky, colorless, or pale yellow buildup of bacteria that regularly forms on your teeth. When your saliva, food, and fluids combine, they produce this buildup, which collects where the teeth and gums meet. Plaque contains acids that attack your tooth enamel and can damage the gums. If not treated, the damage could become permanent. When plaque accumulates and is not removed, it can harden, trapping stains and turning into tartar. Tartar is a yellow or brown colored deposit that forms when plaque hardens on the tooth. Plaque buildup can lead to gingivitis and gum disease, so it's important to speak to your dental professional about the best form of treatment. If you are experiencing any symptoms, make sure you visit a dental professional for a proper checkup.
So now we're going to be discussing some things on this board that can happen in the oral cavity if you don't properly remove the plaque. So first, I'm just going to show you this picture right here. This is an instrument that's kind of scraping plaque off the tooth. You can kind of see it building up right here. Yeah. So if you look in the mirror, you can't typically see plaque. Plaque's invisible. But if you run your tongue across your teeth, you can do that now, and you might feel something kind of like a fuzzy sweater. That's plaque on your teeth. So if you don't properly remove plaque, you can get something called gingivitis, and that's a gum disease where your gum tissues can get swollen, red, inflamed, and really tender. So in comparison right here, you can see the healthy gum tissues. It's nice and firm looking, pink. You see that? And then right here, where the arrows point, you can see how it's a little bit more haloed like red right there. Do you see that? And also down here, if you're ever flossing and you experience a lot of bleeding when you floss, so that's a sign of gingivitis. So your tissues are kind of like angry because of all that bacteria and stuff. All right, Serenity, so if the plaque isn't properly removed, over time it can harden and mineralize and form into something called calculus. And you also might have heard this being called tartar. So as you can see, it forms the little white rings right here. And this calculus can form above your gum line and below your gum line. Do you have any questions as of right now?
Is calculus something you can remove at home if you have it?
So calculus isn't something that you can remove at home. This is why you would come in to see me or another hygienist. We have special instruments that can scrape this calculus off of your teeth, and we can do it in a safe way. So if you tried to do this at home, it's almost nearly impossible to remove, and we don't want you injuring yourself at home.
Oh, okay.
So if you don't go in to see a dental hygienist to properly get that calculus removed, it can lead to an oral disease, also known as periodontitis. And periodontitis is when you experience bone loss. So this calculus can still harvest that bacteria, and it's almost like when your bone is near it, it's like, I gotta get away from this bacteria. So your bone levels start to recede. Whenever you lose this bone, it can't grow back. So that's why we always want you to go in for regular visits to get the calculus removed. Also in this picture up here, you can't obviously see the bone, but you can see how all this is starting to recede and the teeth are starting to look really long. That's because their bone levels are starting to go down. So you can just see the comparison between those. So this booklet just shows the different stages of bone loss. You can flip through it and get a better idea of what periodontitis is and how it progresses. All right, Serenity, so now we're going to be talking about recession. And recession is where your gum tissues start to recede. So you see in this picture right here where it kind of looks normal, and then on these two teeth where the arrows are pointing, the gum tissue's coming up higher. So in another picture, you have healthy and then receded gums. So whenever you're using a toothbrush to remove this plaque, you want to make sure that you're not brushing too hard. So a lot of people think the harder I brush my teeth, the cleaner my teeth are going to be. And that's not the case. So you don't want to ruin your gum tissue by brushing too hard. Do you have any questions as of right now?
Are the gums capable of like growing back?
So the gum tissues cannot grow back. It's kind of similar to bone. Once you lose that gum tissue, it never comes back. So that's why it's so important to be gentle on your gum tissue and to also use a soft bristle toothbrush. Now we're going to be talking about something that's really common in your age group, and that's a coated tongue. As you can see, this is what a healthy tongue looks like, and this is what we want your tongue to look like. It's nice and pink, all the same color. And you look over here, and it's kind of got like a white film to it, and that white film is a bunch of bacteria on your tongue, and this is also something that contribute to bad breath, and we know you don't want bad breath, right?
Yeah.
Now that we've discussed it a little bit, do you have any questions about the coated tongue?
When having a coated tongue, can you use anything to help it besides a toothbrush?
Yeah, so there's something called a tongue scraper. Have you ever heard of that?
No.
No, so it's kind of like a long U shape. It can be metal or plastic, and you kind of use it in a down motion to scrape your tongue. A tongue scraper can be found at like Walmart, Walgreens, or you can find it online, such as Amazon. So when the bacteria that's in plaque combines with certain foods, it can contribute to cavities, which is also known as dental decay, and that's where your teeth start to break down. And these are pictures of kind of like severe cavities. Most of the time we detect them in radiographs, but this is just some pictures of really bad decay. And next we're going to start talking about some foods that contribute to dental decay. On the table we have some foods that you might be eating at your house. What I want you to do is take each of these foods, and on the left side I want you to put the foods that you think are bad for your oral cavity and teeth, and the foods that you think are good on the right side. So you can go ahead and do that. All right, so what I want to talk about, you did really good. So all of these are bad for your teeth except for one thing, and I can understand why it's confusing. So this type of gum, which is called extra, actually has certain ingredients in it that protect our teeth. So if you are going to chew gum, we want you to choose extra or another gum called Trident. Everything else, you did a really good job, and these are all healthy for your teeth, so good job. So now that we went over that board with all the pictures, can you name 3 things that happen in the oral cavity if plaque isn't properly removed?
If it's not removed, you can get cavities, gingivitis, and calculus.
Good job. All right, so what we have here is just kind of like a laminated sheet. You can stick this up on your bathroom mirror, and it's just kind of like a guide to help keep you on track with brushing your teeth, just to kind of create a healthy routine. So what you want to make sure you have from the start is you want to have a toothpaste with fluoride, and fluoride helps prevent against cavities. You want to have your floss, a mouth rinse with fluoride, and it needs to be antibacterial, and you want to make sure you have a soft bristled toothbrush. So first, it says morning and night, so you're going to do all of these things brushing morning and night. And in red, I have just kind of like the main trigger points. So when you're brushing, you want your bristles to be angled at a 45-degree angle against your gum line. So you're going to hold it, and you're going to orientate it like that. And you're just going to do side-to-side motions, back and forth, and gentle. So I'm going to have you try that real fast. Good job. So you want to kind of get, yep. So you want your bristles to kind of get underneath the gum line a little bit as well. All right. And right here it says not too hard. And do you remember why we don't want you to brush too hard?
Because it can recede your gums.
Good. All right. So next is I have highlighted outside and insides and behind your last molars. So a lot of people just kind of focus on the outsides of their front teeth. So you want to make sure you get all the outsides, especially back in these little areas right in here. You also want to do the insides of your teeth. So you're going to do the same thing. Inside, inside, and then it says behind your last molars. So you're just kind of orientate it in your mouth that kind of gets behind your molars, because a lot of people miss back here. All right, so next it says your chewing and biting surfaces, and that's going to be right here. And you'll just do the regular brushing, and you might have to tilt it certain ways because you want to get into those pits and crevices, all these weird nooks and crannies. All right. And also you want to brush your tongue, because we don't want that coating on there because it holds a lot of bacteria. You're just gonna scrape your tongue, or you can use the actual tongue scraper. And this is gonna help with what? Controlling?
Bad breath.
Yep. All right, and we have that in red. So, and when brushing, you also want to make sure that you brush for a full 2 minutes. And something that I find that helps a lot of teens is you can choose one of your favorite songs, and you're going to brush your teeth for the full length of that song. All right, so next we're going to move on to floss. And you want to do this every single time you brush your teeth. All right, so what you're going to do is you're going to wrap it around your 2 middle fingers. And then you're going to be using your pointer finger and your thumb kind of as a guide. So we're going to do something called the C-shape method. And you want to gently go between the teeth. You don't want to damage your tissues. So go in between, and then you're going to curve it around the tooth, and that's going to create a C. And now you want to go up and down the tooth. And this is going to help remove that plaque biofilm as well, because your toothbrush can't actually fit down into these crevices in between your teeth. And then on the same side, you'll wrap it around, up and down. And the same with these front teeth. In between, C shape, up and down. And you'll do this for all teeth, and I'm going to have you try it now. So wrap it around your middle fingers.
Oh, middle fingers.
So middle fingers, and then use your, so C shape. So, yep. So is it wrapped around your middle finger? So it's still wrapped around this one. So just like this. So boom, middle finger, and then use these as a guide. So middle finger, good job. And then use that as a guide. So put it down between, and then wrap it around the tooth, making a C. So curve it around it. Let me see. Yep, and then you go up and down. It's a little bit hard on the Typodont. So you're going to do that between every single tooth, okay? So next, oh, and you can also use kind of like floss sticks on the go. And last but not least is going to be your mouth rinse. It's going to have fluoride, and it's going to have antibacterial agent in it. So what you're going to do is there's usually a cup on the top of your mouthwash. You'll just pour it into the little cap, and then you're going to swish it in your mouth for 30 seconds, and then you're going to spit it into the sink and not swallow it. So now we're going to be talking about something called the rubber tip stimulator, and this is a good dental aid used for gingivitis, and it's going to help with all that inflammation, swelling, and all that. So what you're going to do is just take the tip of this, and you're just going to kind of like trace around the gum tissue, and you can also go in between your teeth, do little circular motions. What this does is going to help stimulate the blood flow to your tissues, and it helps heal and strengthen your gum tissues. So I really suggest this for teenagers that are experiencing inflamed tissues. Now I'm going to have you try it out a little bit. So you're just going to trace along. Yep, good job. So, and then go up. Let's go in one of these front teeth right here. Just go in the middle right here and kind of go in little circular motions just to kind of help massage the tissue. So you just trace along all your teeth. You can do the insides as well. And that little circular motion. All right, Serenity, like we talked about before, you can take this laminated sheet, you can just take something sticky, and you can stick it to your mirror, and this is going to kind of be like a little guide for you to just help you follow a better, healthier routine, okay? So now Serenity is going to be demonstrating the proper brushing technique. She's going to be flossing as well as using a rubber tip stimulator. Serenity, can you name one other dental aid other than a toothbrush or floss that helps promote a healthier oral cavity?
The rubber tip stimulator.
So the rubber tip stimulator, can you tell me a little bit about it?
It promotes health and stimulates gum tissue.
Okay, and how do you use it?
You just like go along your gums.
So yeah, you trace it around the gum tissue. Good job. Now to evaluate how well Serenity did with her brushing and flossing, we're going to be using these disclosing tabs. And what it does is it dyes the plaque biofilm that is left over on the teeth, and we'll be able to see all that left over. So after evaluating Serenity's plaque freeze score, she received a 95%, which is really good, so good job. We did notice that she was missing kind of in between some of her teeth. So Serenity, what are some things that you could have done differently to kind of help those areas?
I could have worked on flossing better, like in the back one.
Okay, and what type of flossing technique do you want to make sure you're doing?
Like a C.
The C-shape method. Good job. All right, Serenity, I just want to thank you for your time today and for being such a good student. I hope you learned some new things that you can take with you for when you're at home taking care of your teeth. So, bye everyone.